Have you ever noticed your dog, your best furry friend, just casually licking their paw? At first, you probably don't think much of it. It's just it's a dog thing, right? But then it gets happening. And suddenly, that little habit kind of morphs into this nagging question in your head. Is something actually wrong here? Welcome to the deep dive. Today we're going to try and unravel a really common canine mystery, that excessive paw licking. It's so much more than just some quirky habit. It can be a vital signal from our dogs,
Yeah.
a key piece of information about their well-being that maybe we sometimes overlook.
Absolutely. And that distinction is, well, it's crucial. While a little bit of self-grooming now and then is perfectly normal, persistent, or sort of obsessive paw licking, that almost always points to an underlying issue. Could be medical, behavioral, even environmental, but it genuinely needs our attention. Ignoring it doesn't just mean your dog might be uncomfortable. It can easily escalate a simple problem into chronic pain, skin damage, and even nasty secondary infections.
And that's exactly why we're diving into this today. Our mission is to equip you with the knowledge to understand why your dog might be licking their paws so much. And really importantly, what concrete steps you can actually take to help them. We've pulled insights from quite a few veterinary articles and some recent research to give you a clearer roadmap. So yeah, let's dive in and become better paw detectives. Okay, so let's unpack the most straightforward possibilities first. Sometimes, the simplest explanation is the right one. It might just be an injury or something irritating their paw. What are some of the first, maybe most common visual cues or behaviors a pet parent should look for if they suspect an injury?
Right. That's where your detective skills really come into play. Yeah. With an injury, you'll often see a very focused kind of intensity on a single paw. The licking usually starts pretty suddenly, maybe right after a walk, or perhaps following some enthusiastic playtime. You might notice them limping or holding the paw up awkwardly. Or if you gently inspect it, you could find some swelling, redness, maybe a visible cut, a blister, or even just a tiny irritating splinter or thorn stuck in there. These foreign objects, even tiny ones, can cause significant discomfort and really prompt that focused, urgent licking.
Okay. So it's about that localization, one paw, and a sudden change in behavior. That makes a lot of sense. Now, if injuries are the sort of clear, specific culprits, what's the broader issue you see most frequently? Maybe walking through the clinic doors. What's the biggest driver of that chronic paw licking?
Well, once we've ruled out an acute injury, the truth is allergies are very frequently identified as the most common cause of excessive paw licking. Many of us think of human allergies as sneezing and watery eyes, right? But for dogs, their skin. That's often the primary battleground.
That's a really fascinating distinction. So it manifests dermatologically on the skin.
Mm-hmm.
How does allergy-related licking typically present itself then? What makes it look different from that injury-focused licking we just talked about?
That's a key differentiator, definitely. Allergy-related licking typically affects multiple paws, often pretty equally, rather than that singular, intense focus on just one spot. It's more of a generalized itchiness that sends them looking for relief pretty much everywhere. You might see them licking all four paws, maybe just the front two, but it's rarely just one single paw when it's allergies.
Okay, multiple paws. And what other signs should we be looking for beyond that? Are there other, telltale clues that scream allergy?
Oh, absolutely. Beyond the multiple paws, look for general redness, sort of a pinkish or reddish discoloration on the skin, and obviously itchiness. And then there are those distinct brown or reddish saliva stains you often see on the fur of the paws, especially noticeable between the toes or around the paw pads. That color actually comes from porphyrins in their saliva. It's a sign of chronic licking. Your dog might also be struggling with recurrent ear infections, that's a big one, or scratching other parts of their body, their belly, their flanks, for example. They might even show some respiratory signs like sneezing or watery eyes, although the skin issues are usually the main thing you see.
Right, the skin issues are primary, so it's not just about what's in the environment, like pollen, but when they're exposed to. Does that mean we should be thinking about things like seasonal changes, or maybe even chemicals we use in our own yards or homes?
You've hit on a really crucial point there. If we connect this to the bigger picture, you might well notice this licking becoming more frequent after walks outside, or maybe during certain seasons. For instance, in spring and summer, with all the increased pollen counts, that's a very common time for environmental allergies to flare up and show up as paw licking. I mean, they're literally walking through their allergens day after day.
Yeah, that paints a pretty vivid picture. So we're talking about a couple of main types of allergies here then. What are they and how do they differ in terms of the signs we might see?
Right. So first, we have environmental allergens. Things like pollen, grass, dust mites, mold spores, or even chemicals they might encounter on walks or in the house. These typically cause what's called contact dermatitis or just generalized itchiness. Then there are food allergies or intolerances. These are often suspected if the paw licking is persistent, maybe year-round, and doesn't seem clearly linked to an obvious environmental trigger like pollen season ending. Food allergies often come bundled with other signs too, like that generalized itching we mentioned, those recurring ear infections, or even digestive upset. Things like loose stool, sometimes vomiting, maybe excessive gas. It might even get noticeably worse after meals.
You mentioned earlier using prescription hydrolyzed protein or novel protein foods for doing food trials. Can you quickly explain why those specific types are effective? What's the science behind that?
Yeah, great question. So for food allergies, the dog's immune system is basically overreacting to specific proteins in their food. Chicken, beef, dairy are common culprits. Hydrolyzed protein diets work because the proteins in the food have been broken down into such tiny fragments, such small pieces, that the dog's immune system often doesn't even recognize them as allergens anymore. It essentially tricks the body, you could say. Novel protein diets, on the other hand, use a protein source the dog has likely never eaten before, things like venison, duck, kangaroo, maybe even rabbit. The idea there is that their immune system hasn't had a chance to develop an allergic response to it yet. Both approaches aim to eliminate the trigger protein causing the reaction.
Okay, that's a really clear explanation. Thank you. Now, you mentioned something else earlier, that constant licking can actually cause other problems itself. What does that vicious cycle look like?
Oh, it's a really insidious cycle, unfortunately. The constant moisture from all that licking creates this perfect, warm, damp breeding ground for yeast and bacteria on the skin. But then, and this is the tricky part, the yeast itself can release compounds that actually increase itchiness. So the infection makes them itch more, which makes them lick more, which makes the infection worse. It becomes a self-perpetuating loop that's incredibly hard to break without some kind of intervention.
Wow, a self-perpetuating loop. And what kind of infections are we typically talking about here? What should pet parents be looking for if they suspect a secondary infection has set in on top of everything else?
Yeah, bacterial infections and fungal infections, particularly yeast infections. Malassezia is the common one, or very common. And boy, can they make your dog incredibly itchy. Signs to look for include increased redness, maybe some swelling, sometimes discharge or pus. And often there's an unpleasant kind of sweet or cheesy odor that's quite distinctive, especially with yeast infections. The skin might also start to look thickened, maybe leathery, or even discolored, sometimes turning grayish or black over time. What's really crucial here is realizing that these secondary problems are often a direct result of that initial excessive licking, which was, in turn, likely fueled by underlying primary skin allergies.
Okay, so we've covered injuries, allergies, and secondary infections. But what if it's none of those? Sometimes it's not just physical, it might be emotional, right? Your dog might be trying to tell you something about their state of mind through this licking.
Indeed, that's absolutely right. Anxiety, boredom, or stress can definitely trigger compulsive licking behaviors. It often starts as a self-soothing behavior. When a dog feels stressed, anxious, or just plain understimulated, licking actually releases endorphins in their brain. That creates a temporary sense of calm or relief for them, so it becomes a coping mechanism. But it can quickly spiral out of control and become a compulsive habit, almost like an addiction, even after the initial stressor is gone.
An addiction, wow. And what can happen physically if this kind of compulsive, maybe stress-induced licking goes on for too long? What's the ultimate physical manifestation of that emotional distress we might see?
In some more severe or chronic instances, this kind of compulsive licking can even progress to what veterinarians call a lick granuloma. This is essentially a chronic self-inflicted wound. It's an inflamed, often thickened, raised, and usually hairless patch of skin. It forms simply because the dog has been constantly, obsessively licking the exact same spot, usually on the front of a leg or paw. It becomes incredibly itchy in itself, creating yet another vicious cycle, and can be quite stubborn and difficult to heal because the dog gets such a strong reinforcement, those endorphins, from the act of licking it.
Okay, so moving away from the internal and emotional causes. Sometimes the problem isn't even internal at all, is it? It could be a simple external irritant, something we might overlook in our detective work. What's an obvious one we should always rule out?
Yeah, a quick check for the really obvious stuff is always warranted. Irritation from fleas and ticks can definitely make a dog lick their paws, or anywhere else for that matter. They might be focused intensely on one spot where a tick has embedded itself, or just generally itchy all over if they have fleas. Good parasite control is fundamental. But beyond parasites, it's also worth remembering that paw licking isn't always just about the paw itself. Other underlying medical conditions, things like arthritis causing joint pain, maybe generalized pain elsewhere, or chronic inflammation anywhere in the body. These can sometimes trigger paw licking too. It might be a displacement behavior, or simply their way of coping with overall discomfort that they can't localize perfectly.
Right, so pain elsewhere could manifest as paw licking. That covers the why pretty thoroughly then. Now let's shift gears to the what to do about it. You mentioned earlier that the approach absolutely depends on figuring out the underlying cause first. So where do we start with management and some at-home care strategies?
That's exactly right. We need to keep wearing our detective hats. The first step is always trying to accurately identify the cause, if possible. But for those times when you suspect maybe just a minor injury or some kind of simple irritation, there are definitely practical steps you, as the diligent pet parent, can take at home to manage it effectively.
Great. Walk us through that. What supplies should we try and gather first? And what's the basic procedure for taking care of a sore paw at home?
Okay, first, try to gather your supplies. Some warm water, a mild pet-safe soap, or maybe just a saline solution like contact lens saline, perhaps some pet-safe antiseptic wound spray or wipes, a clean towel, and definitely a pet-safe antibiotic ointment. Having these things ready makes the whole process much smoother and less stressful for both you and your dog. Now, if there happens to be any bleeding, the first thing is to apply gentle, firm pressure with a clean towel or gauze pad. But, and this is important, if that bleeding persists beyond, say, 10 to 15 minutes despite pressure, that's a clear sign to seek veterinary care immediately. Don't wait on that. To clean the paw, you can gently swish it in a bowl of warm, slightly soapy water, or maybe use a soft washcloth to carefully wipe away any dirt or debris you can see. Then rinse it really thoroughly with clear, warm water, or you can use a saline solution or a pet-safe wound spray to flush it out.
Okay, cleaning is key. And there's a critical warning here too, isn't there? Something many people might mistakenly reach for from their own first aid kit.
Absolutely. A really critical warning. Do not use hydrogen peroxide, rubbing alcohol, or other harsh cleaners on the wound. It sounds counterintuitive, maybe, but they can actually delay healing by damaging the healthy tissue around the wound, and they can cause significant pain and stinging for your dog. Just stick to mild soap and water or saline. Once it's clean, carefully look for and remove any visible superficial debris like little pebbles, bits of glass, or thorns using clean tweezers. However, and this is very important, do not try to dig around for deeply embedded objects. If you suspect something is stuck deep in there, leave it alone. That requires professional veterinary attention. You could easily push it in deeper or cause more damage trying to get it out yourself.
Right. Leave the deep stuff to the pros.
Yeah.
Okay, so once it's clean and any surface debris is gently removed, what's the next step?
After cleaning and drying gently, you can lightly apply a thin layer of a pet-safe antibiotic ointment to any clean wounds. This just helps reduce the risk of infection setting in. Then, depending on the wound and where it is, you might want to bandage and protect the paw. Cover the wound area with a non-stick gauze pad that's important, non-stick, and then wrap it gently but snugly with vet wrap or a similar self-adhesive bandage. Start from the toes and wrap up towards the ankle or wrist. Make sure it's not too tight. You should be able to comfortably slip 1 or 2 fingers underneath the bandage edge. You'll probably need to change these bandages daily, maybe even twice daily if they get wet or dirty, and always monitor the paw above and below the bandage for any swelling, coldness, odor, or discharge signs of problems. And of course, the dreaded cone of shame and e-collar might be necessary if your dog just won't leave the wound or the bandage alone. And finally, probably the hardest part for most owners. Keep your pet relatively quiet and restrict their activity, keeping them mostly indoors until the paw has fully healed. Rest really is often the best medicine, allowing those tissues time to repair properly.
Okay, that's great advice for injuries. Now let's move back to allergies. For suspected allergies, particularly those tricky food allergies, what's the key first step and why is it so crucial?
Okay, yes, for allergies, here's a really critical point. We always stress the importance of consulting your veterinarian before making any drastic diet changes. A vet-supervised elimination diet or a hypoallergenic food trial is usually the recommended route. Why? Because it's a very specific, controlled process needed to accurately pinpoint the actual food trait, if there is one. It's easy to get it wrong otherwise. These trial diets, as we mentioned, usually involve either a prescription hydrolyzed protein food or a novel protein food, and they need to be rigorously free of any common allergens your dog has been exposed to before. During this trial period, which often lasts 8 weeks or sometimes even longer, you must only feed the specified diet, absolutely nothing else. That means strictly avoiding all treats, table scraps, chews, dental products, even flavored medications or toys, because even a tiny amount of the offending ingredient can completely skew the results and make the whole trial useless. Consistency is absolutely paramount for getting accurate results. Otherwise, you're just guessing, really.
Right. That strictness sounds key, but probably challenging. And for those environmental allergens, the pollen, the grasses we talked about, what are some simple practical things we can do at home to help minimize exposure?
Yeah, for pollen or other environmental triggers, some simple steps can actually make quite a big difference in reducing their exposure and hopefully their symptoms. Things like regular baths with a hypoallergenic or soothing shampoo can help wash allergens off their skin and coat, or even just wiping down their paws and belly with a damp cloth or pet-safe wipes after every walk can really help remove those pesky allergens they've picked up outside before they have a chance to cause irritation or get licked off. It's kind of like us wiping our feet on the mat before coming inside, but for your dog's whole body almost.
That's a great analogy, easy to remember.
Yeah.
And you also mentioned those secondary yeast infections that can crop up. Is there a home remedy you sometimes recommend for that? Perhaps some kind of paw soak?
Yes, indeed. For dogs dealing with that excessive licking and the resulting secondary yeast infections, particularly between the toes, there's an effective at-home foot soak recipe you can try. It usually involves mixing about 1 cup of cooled green tea. Green tea is a nice natural astringent and anti-inflammatory, with maybe 2 tablespoons of apple cider vinegar, about 1 tablespoon of salt, like Himalayan pink salt or just plain table salt, and maybe 10 drops of lavender essential oil, which can be soothing. Now, an important caution here. Do not use this soak if the dog has any open wounds or raw broken skin on their paws. The apple cider vinegar, especially, can be incredibly irritating and painful on open sores. In those cases, just using the cooled green tea solution by itself can still be beneficial and soothing. For the soak, you typically immerse your dog's affected paws or toes for about 5 minutes, maybe twice daily, for about 7 days, or as directed by your vet.
Okay, good to know about the open wound caution. Moving on then to those behavioral issues we discussed, anxiety, boredom, or stress. It can be really heartbreaking to see your dog distressed like that. But the good news is they're often very simple solutions, right? Things that can make a big difference for their overall well-being. What are your top recommendations there?
Absolutely. When behavior seems to be the driver, one of the most effective strategies is often simply to increase their daily exercise. Providing more opportunities for good physical activity, longer walks, fetch, running can really help burn off that excess nervous energy, reduce boredom, and promote the release of those healthy feel-good endorphins. You know the saying, a tired dog is often a happy dog, and usually a less anxious, less destructive dog too.
Makes sense. And it's not just about physical activity, is it? Mental stimulation seems equally important for dogs. How can we effectively engage their minds?
You're exactly right. Mental exercise is just as vital as physical. You need to engage your dog's brain with interactive play and mentally stimulating games, things that make them think and problem solve. Puzzle toys where they have to work to get treats out are fantastic for this. Snuffle mats where they have to use their nose to find hidden food are also great. Or even just spending 10-15 minutes a day teaching them new tricks or practicing old commands can provide a really good mental workout. And you can also try to redirect the licking behavior itself when you see it happening. Offer a productive substitute, like a lick mat, those silicone mats with grooves smeared with a little bit of dog-safe peanut butter or plain yogurt. Or maybe give them a new chew toy with an interesting soft texture that they can work on instead of that paws.
Redirecting, okay. And beyond just exercise and enrichment, are there other tools or aids that might help calm a generally anxious dog?
Yes, there are. Certain calming aids can be helpful as part of a broader plan. Things like specific calming chews that might contain ingredients like L-theanine, chamomile, or tryptophan. Or you could try synthetic pheromone diffusers or sprays like Adaptil, which mimic the calming pheromones mother dogs produce. These often work best when they're used in combination with increased exercise, mental stimulation, and maybe even some behavior modification training. It's usually about taking a holistic approach to their emotional state, helping them feel more secure and find healthier outlets for that nervous energy.
Okay, a multi-pronged approach for behavior. So we've talked about the specific treatments for specific causes, but what about some general at-home care? Maybe some temporary relief measures you can use while you're still trying to figure out the underlying cause or waiting for a treatment to work. What are some immediate comfort measures?
Yeah, that's a good point. Paw balms can be fantastic for providing some immediate comfort. They're designed to soothe and moisturize dry, cracked, or irritated paw pads, which can help reduce discomfort and itchiness directly. Some balms even contain bitter agents, like bitter apple, which can help deter the licking itself, offering kind of a dual benefit while the balm moisturizes and protects the skin.
Right. Balms are good. And something as simple as, well, bandages or even dog socks can physically block your dog's access to lick the paw, right? That can allow time for healing and relief, especially maybe after an injury or when you've applied some topical medication you don't want them licking off. Just remember, as many owners know, socks might need to be secured somehow, maybe with some vet wrap or soft tape around the top to prevent your clever dog from pulling them off within about 5 minutes.
Hey, yes, Houdini dogs. But this brings up an important distinction, though, and it's a really crucial reminder for everyone. Things like balms, bandages, and socks do not cure the underlying cause of the paw licking. They are purely providing temporary relief and protection. We're still aiming to identify and properly treat the root problem, whether it's an allergy, infection, or anxiety. But these measures can definitely buy you some time and, more importantly, reduce your dog's immediate suffering while you work on the bigger picture. And just circling back to basics, always ensure you're consistently using effective flea and tick preventatives as advised by your veterinarian. Keeping parasites off the table is fundamental for skin health.
Okay, excellent reminders. So we've gone through a pretty comprehensive list of what you can often try or manage at home. But what's our ultimate litmus test then? When is it really time to stop the home detective work and just call the vet? When do we know we need professional help?
Your own observations are absolutely key here. You should definitely seek veterinary advice if you notice persistent licking that just doesn't seem to improve within, say, a few days of trying appropriate home care measures. Also, any clear signs of pain, like obvious limping, reluctance to walk, whining when the paw is touched, or significant swelling, redness, open sores, or any bleeding from the paws, those are immediate red flags. Go see the vet.
Evidence of infection is another big one. Things like that unpleasant smell we talked about, any pus-like discharge, or just worsening skin condition despite cleaning. That needs professional assessment. And of course, if you strongly suspect allergies based on the pattern, multiple paws, other signs, or you think it might be a chronic skin problem, professional diagnosis and management are really essential because those often require specific prescription medications or long-term strategies.
Right. And what might a vet actually do when you bring your dog in for this kind of issue? What can listeners generally expect from that professional diagnostic process? Well, a vet will always start with a thorough history, asking you lots of questions, and perform a complete physical examination, paying close attention to the paws and skin. Depending on what they find or suspect, they may recommend various diagnostic tests. Things like skin scrapings to look for microscopic mites like demodex or sarcoptes. Cytology is very common. That's where they take a sample from the skin surface, maybe with sticky tape or a swab, stain it, and examine the cells under a microscope to identify bacteria, yeast cells, or inflammatory cells. They might do fungal cultures if they suspect ringworm, or bacterial cultures and sensitivity testing if a resistant infection is suspected. Sometimes blood tests might be needed to rule out underlying systemic issues. And as we discussed, if food allergies are high on the list, they'll guide you through those supervised elimination diet trials. Based on their diagnosis from all this information, they can then prescribe the appropriate treatments, maybe antibiotics or antifungals, oral or topical, anti-itch medications like Apoquel or Cytopoint, steroid creams or pills for inflammation, medicated shampoos, or specific allergy therapies.
Okay, that makes sense. Wow, we've really covered a lot today, haven't we? Moving all the way from those initial, maybe seemingly innocent, curious licks to really understanding the complex web of potential causes and solutions behind excessive paw licking. It just highlights how much our dogs rely on us to observe these subtle signs, to be their advocate, really, because they just can't tell us in words what's bothering them.
It really does. This whole deep dive, I think, reveals how something as seemingly simple or mundane as paw licking can actually be a surprisingly complex indicator of a pet's broader health and overall well-being. It truly underscores the importance for all of us as pet owners to be observant, to not just dismiss these things, but to critically assess the why behind their behaviors.
Exactly. Well, we really hope this deep dive has given you, our listeners, a clearer roadmap for understanding and helping your own canine companion if they're struggling with this. Stay curious, stay informed, and just enjoy that ongoing journey of discovery with your best friend.
Absolutely. And maybe just as a final thought to leave you with, consider how our pets are constantly communicating their needs and feelings to us, often in these myriad subtle ways that we might frequently overlook. What other seemingly minor behaviors, like maybe tail chasing or digging or changes in appetite, what might they be trying to tell us about their world, their health, or their happiness, if only we really took the time to decode them?
That's a great question to ponder. Thank you so much for joining us today on The Deep Dive. Until next time, keep learning and keep exploring.